We've all seen the effects of the aging process, most visibly in our grandparents. We notice they can't get around as easily anymore, or their hearing starts to worsen, so maybe we have to repeat everything once or twice. They become increasingly dependent on family members as their quality of life slowly diminishes. Now imagine this process, which takes decades, sped up to be 8 times faster, and seeing it in children. Hi, my name is Ruben Sanchez, and today I'd like to inform you about Hutchinson-Gilford progeria syndrome, or simply progeria. We'll go over what it is and its symptoms. Next, we'll go over the cause, and finally, the treatments available. Let's begin by looking at what progeria is and its symptoms. Progeria is an extremely rare genetic disorder which makes the children age about 8 times as fast as normal, meaning in 3 months, their body ages around 2 years. This brings about many health problems, the most deadly of which being the hardening of the arteries, which leads to a heart attack or a stroke at a very early age. The lifespan is only 13 years old. It was first identified in 1886 by Dr. Hutchinson and is now estimated to affect 1 in 8 million children. It has been found in over 40 different countries, and there is no ethnicity or geographical region in which the children are more likely to get it. The most visible signs of the symptoms is the physical signs of aging. The Progeria Research Foundation states that at birth, these children are born looking healthy, but within the first year, they begin to display signs of accelerated aging. The first indicator is that they stop putting on weight at a healthy rate. Next, they begin to lose fat, they begin to develop aged-looking skin, and they start to lose their hair to the point of baldness. According to the article titled Progeria, a rare genetic premature aging disorder, published in the Indian Journal of Medical Research in 2014, that by age 2, they are all thin with a small face, a small jaw, big wide open eyes, protruding ears, thin lips, and their skin is thin enough and translucent enough to be able to see the veins on the forehead. Not only does the disease make them resemble a small elderly person, but it also brings with it many of the health complications that you would expect to see in the aging population. According to Tina Hesman, author of Rare Diseases, Sets Research Agenda, published in the Science News Journal in 2013, states that there is stiffening of the joints, hardening of the arteries, and weakening of the bones. And it's the hardening of the arteries which makes progeria a fatal disease. This is what leads to a heart attack or a stroke at an early age, the lifespan being only 13 years old. Death has been recorded as early as 6 years old and as late as 17 years old. This is Sam Burns. This is him at 17 years old, but he died later that year. Now, although progeria mimics the aging process in many different ways, according to Uma Shaknar, author of Hutchinson-Gilford progeria syndrome, published in the Indian Journal of Dermatology, Venereology, and Nephrology in 2010, states that the mind is left unaffected. They continue to develop at a normal, healthy rate. So in other words, mentally, these children are like any other children their own age that just want to play and make friends. Now that we've seen the symptoms, let's go over the cause of the disease. Geneticists working for the Progeria Research Foundation pinpointed the cause. They found that it wasn't hereditary, but it was due to a genetic mutation in the lamin A gene. Normally, this gene produces a protein which helps hold the nucleus of a cell together. But this mutated gene creates a mutated protein, which makes the nucleus of a cell unstable. And it's this cellular instability that makes the cells die off faster. And then this is what prompts the accelerated aging process. Now that we've seen the cause, let's go over the treatments available for it. Many of the medications that are given to them you would also expect in any elderly person, such as medication for cholesterol or for blood clots or a daily dose of aspirin to lower the risk of a heart attack or a stroke. But the most promising treatment comes out of a clinical trial based out of Boston Children's Hospital. Kelly Fitzgerald, author of First Successful Treatment of Progeria, a rare childhood disease, published in medicalnewstoday.com, states that for 2.5 years, 28 different children from 16 different countries, all with progeria, traveled once every 4 months to Boston for extensive assessments. All of these children were given twice a day the oral drug lonafarnib, which is normally used to treat cancer. And at the end of the trial, every child exhibited improvement in one or more of the following categories: increased weight gain, improved bone structure and flexibility of the arteries. Weight gain went up to by as much as 50% more per year, and severe hardening of the arteries went down by as much as 35%, decreasing the risk of a heart attack or stroke, which again is their biggest threat. And it was the success of this first clinical trial that prompted the Progeria Research Foundation to fund a second one, and they remain hopeful in finding the cure one day. There's also support groups such as the one created by the Sunshine Foundation. According to their website, once a year they fund and host an annual Progeria reunion, which brings children with progeria from all around the world to America for a week where they can spend time traveling to the different theme parks here. This gives the children a chance to spend time with children who are like themselves, and also offers the opportunity for the parents to offer moral support and share experiences and upcoming news and events. Now that we've seen that progeria, although it is an extremely rare genetic disorder, it is a devastating one. The accelerated aging process makes them look like a small elderly person, but also brings with it many of the health complications, the most fatal of which being the hardening of the arteries, which brings a heart attack or a stroke and an early death at the average age of 13. Next, we saw that the cause was due to a genetic mutation to the lamin aging, which produces cellular instability, which leads to health complications and an early death due to a heart attack or stroke. And finally, we saw that although there is no cure yet, positive results from clinical trials and new treatments have brought hope to families of children with progeria, and institutions such as the Progeria Research Foundation and the National Institute of Health remain determined in their mission to one day find a cure and allow these children to live longer and healthier lives. Thank you.